Hello everyone, my name is Casey Cheek and this is my scrapbook project week 2 article. For week 2, the article that caught my eye is from the National Academy for State Health Policy website titled 4 State Strategies to Employ Doulas to Improve Maternal Health and Birth Outcomes in Medicaid by Taylor Platt and Neva Kay. The link to the article is attached on this page to check it out. This article discusses how 4 states, Oregon, Minnesota, New Jersey, and Indiana, are utilizing Medicaid to cover doula services for expecting mothers. Essentially, they are trying to decrease the extremely high maternal and infant mortality rates in the United States, especially for Black and Indigenous women who are much more likely to die from pregnancy-related complications. The article breaks down how these states are training doulas, getting them certified, and making sure that Medicaid actually follows through and pays for their services. This is such a big deal because doulas aren't normally covered by insurance and are usually expensive and inaccessible to many mothers. Some might be thinking, why does this matter so much? It matters because doulas aren't just there to hold a patient's hands during labor, although that is a big part of their job. They are trained professionals who provide emotional support, help advocate for patients, and even educate mothers about prenatal and postpartum care. Studies have shown that when doulas are involved, mothers are less likely to have C-sections, more likely to breastfeed, and are enabled to feel in control of their birth experience. Platt and Kay 2020 highlight how Oregon's program alone connected over 1,000 Medicaid patients with doulas in just 2 years, and they saw fewer preterm births and low birth weights as a result. This article ties directly to what we talked about in week 2 about maternal and infant mortality. I think we can all recall looking at the terrifying statistics over how the United States has the worst maternal and infant death rates in the developed world. Doing further research revealed that a big part of the problem is that many women, especially BIPOC women and low-income mothers, do not get consistent prenatal care or feel dismissed by their doctors. Doulas are so significant because they can help bridge that gap. They are like a combination of a birth coach, a therapist, and a translator for medical experiences, which makes pregnant women much more likely to actually go to their appointments and speak up when something feels off. To conclude, this policy feels like one that should make sense to everyone. Deciding to invest in a support system that keeps mothers and babies healthy will pay off in the long run. It seems like this is something that should not have taken this long for Medicaid to start covering, but the success these 4 states have seen thus far is progress. Seeing the progress should absolutely make us all wonder just how many lives could have potentially been saved had this been standard practice years ago.